Okay, we're going to talk a little bit about Chapter 24, Newborn Nutrition and Feeding. 8 questions total come from this chapter on your final, so we are not going to discuss this chapter in depth, even though there is important. We're going to hit some highlights. So what I want you to do is take pages 633 through 641 and just kind of tuck it away. If it's information that you need to review, some of its anatomy, then by all means do that. But we're going to actually start with page 641, where it starts with latch, which is at the very bottom of the page. When we're talking about breastfeeding, and that's what we're going to spend some time in the beginning talking about, the latch is very important. And one of the things that you can do as the nurse is to instruct the parent or the mom how to correctly latch her newborn onto the breast. In order to do that, you need to make sure that the infant's mouth is over the nipple, areola, and the breast, needing to make a seal between the mouth and the breast to create adequate suction. This mechanism of suction is what actually creates the milk removal, and we also need to get the infant's mouth on far enough because it also will stimulate, if the nipple is in the back of the baby's throat, to stimulate the suck reflex. Mom can manually express a few drops of colostrum. She can spread that over her nipple. This will do a couple of things: lubricate the nipple, and it will also give something to entice baby to latch onto in order to get a correct latch. The other thing that is done or educated mom on as she's trying to latch correctly her newborn onto her breast, she will take her breast and she'll actually compress it down. She'll almost kind of make a C and compress it down like a sandwich, or sometimes they'll say a taco, in order to get as much of the nipple and areola and breast into the baby's mouth. It's just another technique. Some of the things we need to know as far as education and patient teaching, and that's a lot of what this chapter is based on, is we need to know when the baby's ready to eat. Babies will show readiness cues. They will put their hand to their mouth. They'll do a sucking motion in the air. They'll do something called rooting, where they're kind of rooting around or turning their head side to side, looking for the breast. Or they'll do something also called mouthing, which is essentially almost similar to rooting, except they're trying to latch on, or their mouth onto whatever object is closest to them. Just a few highlights. Remember, oxytocin is essential to lactation because it's responsible for the actual milk ejection reflex. So one of the other things we can do is, if the infant is not ready to latch on, and this is common in the first few days, mom can kind of caress baby's side of the cheek, or put her nipple close to the baby's mouth, and this will stimulate that open mouth rooting reflex. You also want to make sure that the baby's tongue is completely down.